Doctors often have insider knowledge about the medications they prescribe and take. Surprisingly, there are certain medications that many doctors choose to avoid due to their risks, side effects, or questionable long-term benefits. While these medications are commonly prescribed, many people take them without fully understanding the potential downsides. Here are 5 medications that doctors avoid, but you might be taking unknowingly. Number 1. Proton pump inhibitors, PPIs, for heartburn and acid reflux. Proton pump inhibitors like omeprazole, Prilosec, and esomeprazole, Nexium, are among the most commonly prescribed medications for acid reflux and heartburn. While they're effective in reducing stomach acid, many doctors are cautious about using them long-term due to their associated risks. Long-term use of PPIs can lead to increased risk of nutrient deficiencies, especially magnesium, calcium, and vitamin B12. A higher chance of bone fractures due to weakened bones. Increased susceptibility to infections like pneumonia and C. difficile. Potential kidney issues and increased risk of chronic kidney disease. Doctors often opt for alternative treatments like lifestyle changes, such as dietary adjustments, weight loss, or using milder antacids when necessary. Number 2. Statins for cholesterol control. Statins, such as atorvastatin, Lipitor, and simvastatin, Zocor, are commonly prescribed to lower cholesterol levels and reduce the risk of heart disease. While statins can be life-saving for certain individuals, many doctors avoid taking them unless absolutely necessary due to their potential side effects, which include muscle pain and weakness myopathy, increased risk of type 2 diabetes, liver damage in rare cases, memory loss or confusion. Doctors may instead choose to focus on lifestyle interventions like a heart-healthy diet, regular exercise, and natural cholesterol-lowering supplements before resorting to statins, especially if their cholesterol levels are only moderately elevated. Number 3. Benzodiazepines for anxiety and insomnia. Medications like lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, are often prescribed for anxiety and sleep disorders. However, doctors are well aware of the dangers of these drugs, especially with long-term use. Benzodiazepines are highly addictive and can lead to tolerance, meaning you'll need more of the drug to get the same effect. Other risks include memory impairment, increased risk of falls, especially in older adults, dependence and withdrawal symptoms, increased risk of dementia with long-term use. Instead of relying on these medications, doctors might turn to cognitive behavioral therapy, CBT, mindfulness practices, or non-addictive alternatives like melatonin for sleep. Number 4. Fluoroquinolones for infections. Fluoroquinolone antibiotics such as ciprofloxacin, Cipro, and levofloxacin, Levaquin, are prescribed for bacterial infections. However, these antibiotics are often overprescribed and come with severe potential side effects. Doctors tend to avoid them unless absolutely necessary because of their association with tendon rupture and tendinitis, nerve damage, peripheral neuropathy, aortic aneurysm or dissection, mental health side effects, including anxiety and confusion. Doctors typically opt for safer antibiotics with fewer risks, especially for minor infections where other antibiotics are effective. Number 5. Over-the-counter pain relievers, NSAIDs, for pain and inflammation. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, Advil, and naproxen, Aleve, are commonly used for pain relief, but they come with risks that doctors are well aware of. These medications, when used frequently or over long periods, can cause stomach ulcers and gastrointestinal bleeding, increased risk of heart attack or stroke, kidney damage. Doctors often recommend using these medications sparingly, focusing instead on natural pain relief methods like physical therapy, heat/cold therapy, or, if necessary, acetaminophen Tylenol, which is less harmful to the stomach and heart. Conclusion: while these medications can be effective in certain situations, many doctors prefer to avoid them due to their significant risks, especially when safer alternatives are available. It's essential to be informed about what you're taking and to consider lifestyle changes or alternative treatments that may offer similar benefits without the same level of risk. For more insights into health, medications, and how to live your best life naturally, subscribe to my channel, Miss Savory, for the latest tips and information.